Sometimes you're brought down to the earth because we are all mere mortals. Thank you for supporting me yesterday, and I'm here. I came to Delhi to give you a message, and I'm going to go home after I've given that to you, right? So are you with me today? Would you have some patience while I go through something that I need to? I think the audio visuals are not on. So I had what most doctors would call congestive heart failure yesterday, right? I thought it was, and I think it is, because as a trained doctor, those were the signs. So there were two things that I believe in. I believe in if I can take care of my health, I should. And at that moment, I thought, if I'm dying, then so be it, because then nobody can save me, because that's my time to go. But if I'm not, then I need to handle it myself and not anybody else. Because if I go to the hospital at that point in time, I would be given things that I'm not really happy with, right? So what I did was, I actually helped people to help me out initially. As things started stabilizing, I went back to my room, thanks to Arjun. I had friends here because many of the suppliers here are people who started out because I got them to start out years ago. I had a very close friend of mine, he's not here in the hall, Dr. Satwinder, who was with me. And I think Michael also was with me. So we went to the room. And I actually used the same IVs that I wanted to talk to you about. I first did, of course, what most doctors do, get a diuretic, because I had too much of fluid in my lungs and got that out. And then I needed to stabilize myself. And so I used nutraceuticals. I didn't use medicines. And those nutraceuticals is what I actually want to talk to you about. I want to talk to you about them. Why? So why did I want to talk to you about this? Fantastic presentation since I've come into the hall this morning. I heard Dr. Vishaka speak. Absolutely great stuff. That's as far as your food is concerned, right? This is where, but this is what you can't stop. And that is this toxic chemicals. Why am I talking about toxic chemicals to you? You live in Delhi. You get out on the road and stand at the bus stand. For 10 minutes, you have cadmium that enters your body, equivalent to smoking 2 cigarettes, right? That bad it is. I'm not saying it, modern medicine is saying it, right? So why are these heavy metals so bad for us? Why are heavy metals so bad? Because they actually cause what's called inflammation and oxidative stress, which actually causes all the disease that we have. So we spoke about food so beautifully this morning. She's touched upon everything that I have put here. But this is where we were yesterday. When you get lead and other heavy metals, and what is cadmium? Cadmium is a heavy metal, right? It causes what? It causes oxidative stress and inflammation. And the root cause of all your chronic disease is your insulin signaling. Why? Why is insulin signaling so important? Because at the end of the day, my friends, you need to have that food that you eat that has to be converted to glucose. And that glucose has to hit your cells, and only then will you get the energy. Now you don't have insulin that is putting that glucose in your cells. It's not that you don't have, you have too much of it. And it's not working anymore. That's when the trouble starts. That's what Dr. Patana actually explained to you yesterday morning. When you have insulin signaling issues, you are not going to get energy. When you don't get energy, when you have an energy-starved body, what happens? Irrespective of what food you eat, irrespective of what other measures you do, you are not really going to feel healthy. So this heavy metals are one of those things that cause you problems. What are the others? Pesticides. You're not eating pesticides. You know, years ago, I used to travel to a place called Surat in Gujarat. And I had a 86-year-old man who came to me and said, Doc, this is my angiogram. You know, I used to do a lot of heart patients. I've done about 35,000 plus. This is my angiogram. How did I get this heart disease? I don't smoke. I don't drink. I don't even eat non-veg. And so I told him, oh, you don't eat non-veg? He said, yes, I don't eat non-veg. I said, God help you. You know why? Because these pesticides come in your veggies, my dear friends. An animal can go out and excrete what it takes in. A plant can't. All our plantations, all our commercial veg growing operations, what do they spray? They spray pesticides. Do they poison you? No, they don't. They get into your body and they eat you like a small, slow cancer. They go and block biochemical reactions in your body. Those biochemical reactions, over a period of time, as you keep blocking them, that's when disease sets in. And so people come and tell me, hey, but my brother eats the same food as I do. Why didn't he get that disease? He didn't because his genetic SNPs and yours might be different. Because at the end of the day, this is an epigenetic factor that will affect your genes, that will switch on a disease gene, right? It's not enough for you to have a gene. If you have a gene for diabetes, you will not get diabetes unless the environment around it helps that gene to switch on. This we have not understood. If we understand this, then we will understand we need to get rid of some of these epigenetic factors. So what else? Air pollution, like in Delhi. Endocrine disruptors. This was where we were. Obesity and inactivity. An element doesn't get destroyed. It gets into the ground. It gets into your food chain. We need to know how to dispose our garbage. We don't. Today we use fantastic mobiles. What happens to the batteries? They go into your food chain, for God's sake. Are you even bothered about it? You're eating it. And you're killing yourself. And then you try everything to get yourself all right. It doesn't happen. You need to stop the source. So let's look at if there is any evidence to what I'm saying. Does modern medicine accept this? Or is it just something that this idiot is talking before lunch and stopping you from going for a good lunch? Right? Yes, there is. This was about heart disease and lead. This is about arsenic. This is about, again, arsenic and arterial disease. That's your heart disease and strokes. This is, again, people who had bypass surgeries had higher amounts of arsenic. So not very old. Last 20 years, we've got this data. This is about mercury and heart attacks. Then you have, again, this is about mercury and heart. This is again about mercury. This is very interesting. These are very, very recent, okay? They talk about how heavy metals affect your gut. But more interesting is this. These are all studies that have come in the last 3-4 years. So this is very interesting. If you have heavy metals going through your food, what happens to your gut? Causes inflammatory bowel disease, but once it affects your gut, it also causes cancers, causes atherosclerosis, causes obesity, liver disease, kidney disease, cardiac, autism, epilepsy, atopic dermatitis, and you name it. Right? So this has possibly everything you suffer from. Root cause, what you put in your mouth, for God's sake. Can you get rid of it? Yeah? What goes into your mouth is what causes all this. If you can get rid of it, you have a 50% chance you won't suffer from all of this, right? Which is a huge benefit if you're actually getting rid of your heavy metals. And so, part of the thing is they say you do probiotics. Not all probiotics are going to get rid of your heavy metals. What are the symptoms that you see of heavy metals? Watch this. This is something that everybody comes to me with. Chronic fatigue, for God's sake. Depression. Anxiety. Insomnia. Digestive problems. Hormonal issues. Autoimmune disease, of course. How many of us don't have this on a regular basis? Okay, we've had this sometime or the other, but do we even ever think that this could be because of heavy metals? You need to, if you get this constantly. Maybe you get it once in a year, it's fine. But if you're getting it every 2 months, every 3 months, you need to figure out why. And then you ask me, do I go and need to do a heavy metal toxicity test? Maybe later if I feel that you need to. But a normal cardiometabolic test that we do can tell me whether you have metals that are affecting your body or not. Simple inflammatory markers will tell me that. I don't need complex tests. All right? So what happens is, when it comes to most adults, heavy metals actually accumulate in your tissues, but they start as a steady decline in energy that affect you initially. And you say, oh, it's just aging. Which then go on to complex things like heart disease, vascular disease, strokes, and cancer. But while the patient comes to all of us, including me, and I'm guilty of the same thing, when patients come to us, we don't suspect heavy metal toxicity. Now, because we have a standard operating procedure of checking everything, all the markers of inflammation that we want to check as a routine before I put down my pen to tell what I want to do for the patient, we get a outcome of whether the patient has some heavy metal toxicity or has started it. So the real detox is at the cellular level, and you need to stop the source. If you don't stop the source, you're not in a position to get rid of what's happening. All right? So when you stop the source, there is something which is very important that takes place. This is methylation. I don't know how many of you have heard of this, but this is more for doctors. But you need to understand that if your methylation is affected, it is in every cell of your body, you are truly going to get disease, chronic disease, sometime in the future. And you know what? The good part of all this, the good news, you can actually check with a simple test, blood test early morning, whether your methylation is affected. All right? Somebody asked me what? Homocysteine. Homocysteine, which most cardiologists don't want to do because they don't know what to do with it. But it's also a sign that you will get heart disease if it's high. So, complete detox, my dear friends, has two things. One is removing the heavy metal out of your tissue, but that's not the only problem. The other problem is taking it out of your body. Otherwise, it gets reabsorbed in your body, in your gut. All right? That's the body's natural way of holding on to your nutrients. So what the heavy metals do is they enter your body and they trick the body into believing that it's a nutrient. So you need a substance that will take it out directly out of your body. So that's called a detox. So therefore, though these are very good detoxifying agents, they're not true detox. That's good for us making money when we have nice wellness centers. Cilantro and chlorella don't detox you, because they'll bring it down into the gut and they'll leave it there. They don't take it out of your body. You need good binders. You need to have good binders that will take it out from your body, from the cell, from the tissue, and take it out of your body through whichever pathways it can take it out. All right? So when it is done, what happens is your gut reestablishes, your immune system reestablishes, your body starts healing, and behold, your disease reverses. Now, modern medicine doctors say, you can't do that. We were doing diabetes for years, reversing diabetes. I still remember a very, very senior diabetologist in the country who about 7 years ago said this is a whole lot of bullshit. You can't reverse diabetes. And he goes and does the same presentation last year at the ADA because he's been sponsored by a company that does the same thing today with deep pockets. And now he doesn't call it reversal of diabetes. He calls it diabetes remission. So we say, okay, diabetes remission, we'll accept it, right? So you can reverse all chronic disease if you know what causes it. Now, what are your detox options? What I use and what I've used for heart disease is chelation, and that's IV chelation. I use EDTA, glutathione, vitamin C, ALA. These are the substances that take it out of your body directly. Now, those of you who can't do IV stuff, you have the option of doing an FIR sauna, and I'll explain to you the benefits of that in a short while. And of course, then you have oral chelators, which are DMSA and ALA. ALA, incidentally, is available in any of your pharmacies. It's an antioxidant called alpha-lipoic acid. Only problem is they give you 100 milligrams of it every day. You want to detoxify using oral? Use 600 milligrams of it. 300 morning, 300 evening on a full stomach. Nothing's going to happen to you. It's an antioxidant, for God's sake. Right? So these are what I just spoke to you about. Now, what is EDTA? EDTA is a process by which we give you IVs twice a week over 25 or 30 sittings, but that's complete detoxification. You don't need to do it again in your life. You may do it about 5 or 6 times a year after that, because at the end of the day, when you actually go and sweep your house and clean your house, you don't do it once. You do it regularly. So if you live in this environment in Delhi, you need to detoxify yourself regularly. But the first time when you use this, you do it 25 or 30 times. After that, each year you do it 10 times. I can guarantee you, nobody can do this, but I can guarantee you from my practice, you won't get diabetes, you won't get cancer, you won't get heart disease if you regularly detoxify yourself. I have seen this in my patients. I've seen people who have had heart attacks who have not got this. Personally, I had a heart attack about 14 years ago. I did chelation. And I still messed around with myself, right? I never did anything that was spoken over here, though I knew all of it because I was too busy. But chelation helped me, detoxification helped me, right? DMSA is a beautiful oral medication that we use, again for detox. We use it for autism kids. But those who smoke should do it once a week at least. It's an oral capsule that you can take. Alpha-lipoic acid, like I told you, is available orally, it's available IV. It's excellent, something that all of us can use to be okay and to kind of be safe. Oh, by the way, for those of you who are pre-diabetic, ALA actually prevents you from going into diabetes fully because it does cause insulin sensitivity and it prevents problems of diabetics if you are diabetic already. If you're a diabetic already. Vitamin C, one of the most maligned vitamins I've ever come across. People say if you give high-dose vitamin C, nothing happens. Believe me, high-dose vitamin C helps a lot of conditions. But the one thing it does, it actually detoxifies you. It chelates most of the heavy metals. It does. What about glutathione and NAC? Many of you use it for skin whitening. You know why skin whitening works? Because it actually removes heavy metals from your cells. It helps the cell reestablish methylation. That's why glutathione helps you to look better, your skin brightens up, because the heavy metals are removed. If you look at any smoker, especially a lady, you'll see thin, very tiny dots, brown-colored dots, which you can't see normally. But that's because of cadmium. So both of these are used in your wellness drips in so many places that are opening up now. They say we're giving you a wellness drip. You look good, skin drip. These are the ones that they give you, but they're actually detoxifying you, and that's how they work. So chelation does the biochemical detoxification, my dear friends. It actually is the gold standard to get into your body and remove stuff out. You want to remove detox, you want to detoxify, you should be able to do it on a jet. This is the jet for you to do it. All right? But if you can't, you're too scared of the IVs, then I have something else for you. Because skin can also detoxify you. So you have 7 channels. One of them is the skin, and it's the largest organ. So why can't we use that? And how do we use that? Because we can use far infrared saunas. What's the difference? Sweat from a conventional sauna is 95 to 97% water and salt, right? But our skin has both glands, sweat glands and oil glands. Sweat gets rid of the water soluble, but it also helps you to get rid of some of the heavy metals. Oil glands remove the other toxins. And what are the other toxins? Everything from gasoline, solvents, pesticides, other ingredients that your toothpaste has, all of that gets out because of the oil glands. This happens in a far infrared sauna. Why? Because far infrared saunas can take your heat above 45 degrees. And so at above 45 degrees, even your fat cells start opening up. Most of the crap that you have in your body is sitting in your fat cells. So that's why they say weight loss is good with far infrared saunas. But if you do far infrared sauna twice or thrice a week, you are detoxifying as good as having an IV every week. And so far infrared sauna is something that all of us can invest. It's not very expensive. Somebody actually had the audacity from Bombay to write to me and say, Doc, I can afford that far infrared sauna, but I can't afford the space that I have to keep it on. For God's sake, it is a size of a little bigger than this in breadth. It's 2 by 3. Why can't you use it? And it's a one-time investment. I'm not trying to sell anybody's far infrared sauna, but I think you should make a decision to detoxify first before you employ anything else that you have learned at the last 2 days. Because whatever you have learned in the last 2 days won't work for you unless you remove what is inside you. You can't fill a glass which is already full of crap. All right? Yeah? So with that, what else it does a lot of these things. It helps you get rid of a lot of the bacteria. Oh, one of the ways that you will always know, yeah, my time's up and I'm going to take only a minute more. One of the things that far infrared tells you very, very easily, the machine tells you whether it's working or not. And one way that the machine tells you it works or not is when you throw a sweaty towel in it on Saturday evening and open the door on Monday morning, your sweaty towel doesn't sweat anymore. You keep boiled rice inside it for 5 days, it doesn't rot. Even when it's not on. That's what a far infrared sauna is supposed to do. It will help you detoxify. It will help you lose weight. But the best thing it does, if you have fibromyalgia, any kind of pains in the body, they disappear. And the best thing, once you have done your far infrared sauna, if you do not have a bath, you wipe yourself and get out, it's as if you have just had a bath. And you don't even smell sweaty. All right? So it's that good. Steam is not the same as this. Steam is below 40 degrees. It doesn't. It's only giving you water out, nothing else. You need to look at skin, and this is one of the reasons why I said I want to talk about this and give you a message. Just using your skin and far infrared saunas, you can detoxify, and then use all the measures that you learned over the last 2 days to get your health back in your hands. All right? Yeah, I'll take that question. One question I'll take. So explore the possibility of far infrared sauna, but if you already have chronic disease, my dear friends, before you employ anything else that you have learned, detoxify yourself first. All right, that's my message. If you want more information, read the book in your bags. I thank Arjun and Sanjay for putting it in your bags. You have all the information there, and you can use it for your best. 1 minute. I'll take that question and come to you. Can I? Just 2 questions? Yes.
Thank you, Dr. Lenny. Quick question for me.
Yeah.
Sunscreen. Does sunscreen have heavy metal, the usual sunscreen we use? And if not, if it does have sunscreen, then what's the alternative?
So sunscreen, so for me, if you ask me the question, my answer to you would be no sunscreen.
Yeah, so then what's the alternative?
The toxins that it has are all preservatives. Those preservatives are bad for you. All right? And what's the alternative? Why do you need a sunscreen? You're scared of the sun.
No, my skin
The sun is the only one that gives you vitamin D. Yeah, it also gives you the same thing that I'm putting in the far infrared sauna comes from the sun. The infrared rays of the sun enhance your melatonin in your skin and in your cells. It's called subcellular melatonin. And that melatonin is anti-cancerous. So why do you say sun gives you cancer? It's the guys who wanted to sell you the sunscreen who actually told you the sun is bad for you. And I can create that research and show it to you. But I can show you other research that tells you the sun is beneficial for you and you will get no cancer from there. All right, so don't use the sunscreen for God's sake. It kills you.
So we have another question. What about sunburns and darkening of skin?
So sunburns. So who's told you to go and stand in the sun when you're going to get sunburned?
If there's an athlete, for instance, who's playing in the sun for 10 hours or
So
whatever,
that's a different issue. That's a
what do
professional hazard.
so they can do it or not?
So they have a different way of doing it and they get detoxified because they work out as much. You don't.
Yeah.
All right? So their system is a little different.
So actually, I have already read this book, and this is amazing book.
Thank you.
So my question is, what is the difference between calcium EDTA and sodium EDTA?
Oh, awesome. Sodium EDTA. So calcium EDTA I would use for lead poisoning, acute lead poisoning, calcium EDTA.
Okay.
I will not use it for heart disease or anything of that sort. Why? Because at the end of the day, I don't want to put calcium in and take something out. I can put magnesium in and take something out.
Okay.
You understand?
Yes.
Okay,
And
then-
one more question, actually.
Yeah.
How vitamin B17 safe for the cancer patients?
I don't use it. I suggest you don't use it either.
Therapies you've mentioned like ALA or DMSA or others, the oral ones, do they have any side effects?
So everything that you put in your mouth has some side effect. If you don't know how to use it, you need to use it as per the protocol, and then there's no side effect. Yes, ma'am.
Inflammation markers that you mentioned, are they just CRP, ESR?
So the best
ferritin
is
level?
ESR and NHS-CRP. If you have that, and if you're showing those are going up, then you do a detailed test.
But is ESR really, I mean, it's not very conclusive, right?
No,
Is
it's not
CRP
conclusive, but it gives me an indication. If I see your HS-CRP at 4.5, let's say, or 3.5, and your ESR has gone up, I know that this inflammation is
They're
starting.
connected, yeah.
So then I take a call and I tell my patient, hey, listen, this is a possibility in the next 3 to 6 months. Do you want to do something now, or when you get a disease 3 or 6 months now, down the line? So the choice is yours.
And in omega-3, would you suggest fish that comes from like small fish like sardines, krill oil, or salmon, which is high in,
So
you know,
eating
mercury?
fish, I always prefer the high seas, not the estuarine fish. But omegas,
Any ratio of EPA? to
no. So
DHA?
I don't use too much of omegas that are commercially available.
Right.
The krill oils that are commercially available, I've tried all of them. I'm really not happy with them. I'll be honest with you. But there are a few omegas that do come from overseas.
Like
the
sources
one that I
natural.
use, something called Pro Omega D. So if I was using it for myself, I would use that. And so for my patients, because I don't get it, I don't prescribe it. The ones that are available here in India, there's only one. It's very difficult to get it. The trade name is Cardepa, CARDEPA, manufactured by a small company in Chennai called Novo Medicament. It's a very good EPA DHA, but you don't get it everywhere.
And is there a certain ratio we should look
That's
at?
got the best ratio.
2:3? Or?
I don't know. That's the best ratio. Something like, if I'm not mistaken, it is 7:11 or something like that.
Okay, super. Thank you.
There's also danger of mercury in that.
Yeah. So
That's what I want to know. Is it better to take it from food or the supplement? Because
So-
I was told that if you take high quantity of like tuna or something, there's always a danger of
So
mercury.
whatever you do, you go by a thumb rule. The fish in the high seas, where are they going to get their mercury from, for God's sake? They don't get it.
Well, tuna from Japan is like so loaded now. With,
Yeah,
you know,
because
salmon is good, of course,
Yeah.
which is the highest.
so you
But
take
you
it
know,
from the high seas. I'm not talking about Japan.
Tuna is also high seas.
Yeah, so tuna which you get in the high seas, let's say in the Antarctic, is okay.
Antarctic. Okay.
No, sorry, I mean the Arctic,
Not from Japan. and
the
those,
Atlantic Ocean.
So
Not
we
from
should-
Japan. Because
we should
Japan,
avoid
what has
that.
happened,
Correct.
there's an issue with Japan because of the problems with Fukushima, the radioactivity.
Right.
That is the one that's causing the problem.
Correct.
It's not the mercury. Mercury you see in the estuarine fishes.
What is actually estuarine?
Estuarine is along your coast.
Coastal, right?
Yeah.
Okay.
So that's
Coastal
where you
fish.
get a lot of mercury.
So Japan is a problem for whatever.
If they're using fish along their area.
Well, they are.
Yeah.
So, I mean,
So they are high-fat fish, they're good. I would eat it, and then I would detoxify myself. I'm giving you the truth. I love sardines. I go to Portugal only for sardines. Local fish, where do you get local fish from, sir? I come from Goa. Okay, for Goa, all our fish goes to Japan. All right? All our fish goes to Japan. We don't get fish from Goa. We get fish from Orissa. And that also from the high seas, because the trawlers go out to the high seas, bring it in, they put it in ice and they bring it to us. So there's no fresh fish. There is no fresh fish ever. It's all iced. So that even comes from Goa. Kerala takes a lot of stuff from Goa, and that's what's given to the rest of the world. Absolutely. And it's pushed in the soil.
Okay,
it's
we're
pushed in the water, rather.
going to wrap it up.
Yeah.
Thank you, Lenny. So
Thanks for giving me this opportunity. Thank you so much.